Welcome back. It's Thursday, it's time for Doc Talk.
So every week we take your questions directly to the people who are best suited to answer them. And joining us now live is Dr. Dina Tom. She's a pediatric hospitalist with the University Health and UT Health San Antonio. Thank you for joining us today.
Thank you.
So these are some questions that people sent in. We'll start with the first one here. This person wants to know, what are some illnesses going around in children this time of year, spring break?
Yes. So I was just on service a couple weeks ago, which means I'm seeing kids in the hospital. And one of the things we definitely noticed was a virus that we as pediatricians call a mean virus. Flu is one of those. COVID used to be one of those, but it's called human metapneumovirus. And it's not a new virus. We've known about this virus for many, many years. It causes the cold, common cold in adults and teenagers. But in little babies and infants who were premature, it causes a nasty pneumonia and asthma attacks in kids with asthma. So we definitely notice that's coming in a surge right now.
What should people watch out for? What should parents watch out for in their children?
So coughing, really a lot of coughing, that kind of high-pitched, raspy, mucousy cough, lots of secretions, difficulty breathing. That's the biggest thing. And, you know, we have a late winter in San Antonio compared to the rest of the country, so we kind of can predict what comes. It's not surprising it's showing up now, but it's unfortunate because it's beautiful outside.
Like you said, that's one of those illnesses that affects children differently than adults, teenagers. How about oak allergies? I mean, do children get oak allergies?
They do. They do. We don't typically see allergies in kids under about 2. Because it takes that long for a child's immune system to start to mount that. And allergies are the opposite from what we think of with other diseases or infections. When our body gets exposed to allergens, our allergies get worse over time. They don't get better.
Yeah. Really?
Yes. For most people, they do. And it's more exposure, actually, we get potentially worse. Whereas if you get a cold, you get those antibodies and then you start to feel better, or it doesn't hit you as hard. So we definitely see that in kids over 4. That oak is falling, it's yellow, I get yellow dust on my car, and even my kids are sneezing, feeling tired. So really safe to take some over-the-counter Claritin and Zyrtec for children, just read the label.
So, I'm a kid over 4, so I'm glad to know that's what's happening.
Me too.
If your kid has dealt with allergies in the past, can you sort of do that preemptively?
It's not a bad idea. Just being aware that if this is something that your kid struggles with, talk to your pediatrician about what's safe to start with. But some kids are on a children's Zyrtec every day. My son tends to have just that chronic runny nose and sneezing and feels kind of groggy. So on those days where especially I know that the pollen's high, I just go ahead and give it to him in the morning before school.
So now that we have spring break, the summer break is officially around the corner. So now that it's getting warmer, what are some water safety tips that you have for parents?
Okay, so yes, we all want to go swimming. My daughter really wanted to go swimming this week, and I had to remind her there's no pools that are really open right now. But yes, so one of the best things you can do for your kids, aside from sun safety and what they're wearing, we talked about that the last time I was here, is assigning a water watcher. So the American Academy of Pediatrics and on our University Health website, we talk about what that means. But a water watcher is where adults get together and decide who's responsible for the kids. Because drowning is the #1 cause of death in children under 4. So we want to make sure that we're vigilant about assigning a person. Adults, we get together around the pool, we're enjoying it, having a good time, assuming, because there's so many of us, that we're watching the kids. And really that's the most dangerous time, because we're all believing that somebody is watching our kid. So put your phone down, assign one person. That's the hardest part, right? And you're responsible. You wear your bracelet, or you have the sign, or whatever it is that assigns you as the person for the next 30 minutes. You're responsible for the kids.
Yeah, make it clear.
Yes.
You're the person.
It's my job.
Then we'll trade off at moments if you need to, but it's very important to have somebody in charge.
You're the DD for 30 minutes.
Exactly.
I was going to say that's what it sounds like.
It does. I mean, really, and just be responsible about it, and then trade off so you can have fun too. But really, everybody can feel good knowing, Steve's in charge.
Yeah. Maybe not everybody.
I don't know.
But all right. So, all right, the serious topic now: measles. We've heard about outbreaks that have happened in certain places throughout the country right now. Is my child at risk of measles? How can I protect my child? And how concerning is this to you as a health professional?
This is really scary as a health professional, I'll be honest, because in 2020, the U.S. decided that we had nearly or pretty much eradicated measles.
Yeah.
And it was very exciting. And then COVID happened, and really due to COVID and lots of children getting delays in their vaccines, we've ended up in a situation now where we have, we definitely have a group of parents who don't feel comfortable vaccinating their kids. And then we have a group of parents who wanted to vaccinate their kids, but then they got behind on those vaccines. So yes, we are seeing, right now we have as many cases this year as so far that we did the entirety of last year. So it's scary. And measles is one of those things that terrifies healthcare workers. It terrifies the public health community because it takes such little amount of measles just in the air floating around. It's not something you have to touch or be close with someone. It just has to be around. So yes, a majority of those cases are unvaccinated, and then they spread like wildfire. So the best thing to do is just get into your pediatrician and get those vaccines for your kids.
But before we let you go, I think we'd be remiss if we didn't talk about Dr. William Henrich and the impact he had on UT Health and University Health. I mean, you guys worked together hand in hand. Your reaction to his passing away today, the former, I guess I'd call him former president because there was an interim president that was in that role, but he passed away today from cancer. Your reaction?
Yes, a complete and utter shock, just devastation. I don't think I've fully realized that that's happened yet, even though I've received several emails about it and keep reading through them as if it's something that anybody should have expected, because he just so much embodies the culture of our health science center. He was a personal friend and professional mentor for me. I've known him for 15, maybe longer years, since I was a medical student. And he is just loved by so many that I don't think that his spirit will leave our campus.
That's what I was going to say. His legacy will never go away.
No, he's a beautiful man. His wife is an incredible woman, and our thoughts are with them right now.
Thank you for letting me ask you that question, because I didn't want to go through this without acknowledging what an impact he had, not only on the Health Science Center, but the city. I mean, he was a giant.
He shaped our city. It's going to be hard to fill those shoes.
Thank you for sharing your experience with us. Thank you. Dr. Dina Tom, pediatric hospitalist with University Health and UT Health San Antonio, thank you so much for joining us. We'll see you soon.